Hi, I'm Dr. Vinod Gadiyar. I'm a consultant in anesthesia and pain medicine. I'm the revalidation and appraisal lead for Berry and Rochdale Care Organization at the NCA. I'm covering the areas essential uh, components of medical appraisal. This is useful for both appraisees and appraisers, but more so for appraisees. The next slide represents four domains of the General Medical Council. The whole appraisal process is underpinned by these four domains, and these are knowledge, skills, and performance, safety and quality, communication, partnership, and teamwork, and maintaining trust. The next slide is a depiction of medical appraisal guide. This was released in June 2022 by the Academy of Medical Royal Colleges. There has been a feeling that the medical appraisal was burdensome in many areas, and this became even more evident during COVID, and a simplified 2022 version is now accepted. This diagram is showing you essentially the whole process of medical appraisal. This shows the three steps of appraisal process. The input is completed by the appraisee, followed by a confidential discussion between appraisee and the appraiser. The output form is completed by the appraiser. The whole process of appraisal is complete only when the appraisee accepts the output form and completes the feedback. The next slide shows you what is necessary in the appraisal folder. The personal information such as name, GMC number, and your contact details and qualifications, adequate indemnity cover arrangements are in place to cover their whole scope of practice, in addition to Crown indemnity. The appraisal information is about appraiser's GMC number, name, and contact details. The appraisal date should be there, and the designated body, which is the Northern Care Alliance, and the responsible officer for revalidation, recommendation, due date, and scope and nature of work are part of this slide. You need to add the whole scope of work and the nature of work, including voluntary organizations and work in public, private, or independent practice, locum work, or leadership, managerial, academic, research, and educational roles, updated for each appraisal. Supporting information includes the following: continuing professional development, quality improvement activity, significant events, feedback from colleagues, feedback from the patients where it is applicable, review of complaints and compliments. I will talk on these in the future slides. PDP and CPD, appraisee can suggest these before the appraisal discussion. The next slide shows you the quality improvement activity. The most common quality improvement activity is conducting a clinical audit and closing the loop. Other examples are displayed here. The GMC expects you to do at least one quality improvement activity in a revalidation cycle. The next slide shows you the SIRS report, which is added to your folder, which has got details about significant events that you were part of in the previous year. This includes incidents, complaints, PALS entries, compliments, and inquests and claims. Appraisee needs to reflect on the above and learn lessons from them. The next slide is about the colleague and patient feedback. All through the year, one may get compliments from colleagues and patients, and these should be added to the appraisal folder. A formal 360-degree patient and colleague feedback needs to be undertaken once in 5 years, usually in the third or fourth year of appraisal cycle. Next slide is about review of compliments and complaints. You can add these as we go along, and you can modify this as per your specialty. This is a suggested list that can be provided to the appraisee by an appraiser. You can modify this as per your specialty. The slide 16 is about confidential discussion between the appraisee and the appraiser. The appraiser will be able to give some feedback to the appraisee, and appraiser needs to challenge the appraisee and support them, which is a very fine balance. After COVID, a lot of importance and attention has been paid to one's well-being, and appraisal provides a good platform for this. Thank you.